Many of my patients have complained of lack of core strength after pregnancy, and this manifests itself in many ways. It's difficulty picking up a baby, or playing football in the backyard, or even getting out of bed in the morning. And this can often be quite painful too. Not to mention the urinary incontinence that comes about on laughing, coughing and sneezing. In 2014, we noticed patients in our own practice having significant improvement in both lower back pain and urinary incontinence following abdominoplasty. This led us to do a national study with 214 patients in Australia that has now been published in Plastic and Reconstructive Surgery, the peak plastic surgery journal worldwide. Pregnancy puts a lot of strain on the body and it frequently doesn't recover. There's often a separation of the muscles at the front of the abdomen, and this leads to poor core strength, which then transfers down into the pelvis and causes problems with low back pain and urinary incontinence. The operation to fix it, an abdominoplasty or tummy tuck, sews together the muscles at the front of the abdomen, which leads to a significant improvement in core strength. This in turn translates into a dramatic improvement in lower back pain and urinary incontinence. In 2016, Medicare restricted the abdominoplasty item number to weight loss patients only. This study has shown incontrovertibly there is a functional benefit to performing an abdominoplasty on post-pregnancy women. The Australian Society of Plastic Surgeons is calling upon the government to revisit the decision to restrict this item number so women suffering from chronic back pain and urinary incontinence can claim their operation. If you had a sporting injury, you'd get it fixed. Medicare would help you, along with your health insurance, to have your knee done. But this is the same thing. You've sustained an injury as a result of your pregnancy. Medicare and your health fund should be helping you fix the problem. So previously, they had significant out-of-pocket expenses when their health insurance was paying to have the operation performed at a private hospital, but now that's far less affordable. Now the health insurance isn't contributing, and the government earns GST on the operation now as well. I think the item number should be restored to make the operation more affordable for women who need it.